work with Fairview clinics. In my practice as a nurse practitioner, I do primary care. I have my own panel of patients, and just got done seeing patients this afternoon. So what do I have to say with all these great minds at the table? I bring a perspective that's a little bit different. I don't have a perspective on whether we should have single payer or competition or whatever. What I want to talk about is whatever place we land on, what should be a key characteristic of that plan? And that is there needs to be a spot for innovation. And what I'm talking about is to just bring you stories about the journey I've been on in the last year. Fairview has partnered with Medica over the last year. We both realize that we're part of the problem. We realize that healthcare costs too much. Medica realizes payment patterns are part of the problem. So we've said, you know, we're going to own our part of the mess and we're going to try and clean it up. And what we believe is that the people on the front lines own the answers to part of these problems. Because the truth of the matter is, if everybody in the United States has health care coverage, it's still going to be pretty darn expensive. And so what I would advocate for today is that whatever system we make, that we're able to flex and change the way we pay so that as new cultural things come along and new innovations come along, that we can actually get paid for our work. So, for instance, in our care model innovation, we've been working on new teams of people to care for patients. Our diabetics can come in and be seen in groups. Our diabetics can come in and in one visit be seen by their diabetes educator as well as their primary care provider. And wouldn't it be lovely if you could see your primary care provider and your cardiologist together? These are some of the innovation things we're trying. We're thinking of ways to use monitoring devices in people's houses so that we can collect information to manage your care so you don't have to arrive at the clinic. But the truth is, right now, we can't get paid for a lot of that work. And that's why Medica has agreed to help us with some funding so that we can learn to do this new kind of care, get better outcomes at an ultimate reduced cost and better patient satisfaction. And so, in the future, if we don't make a place for this with our new healthcare payment system, we will simply be back at this table in a year or two because it's going to get broken again. Part of the problem with our healthcare today is it's based on a system of payment that supported healthcare in the 1940s. If we don't design something that can change with the times, technology is changing so fast it's going to get broken in a very short period of time. And so, as we think about that, one of the things that I also would say is it takes money to innovate. And right now, the truth is for Fairview that we've been underpaid about $163 million for Medicare care in the last year. So we need to think about where we shift those costs and who bears the burden of shifting into this new world. And it shouldn't be just on the backs of the providers because I think we really own the answers to how to fix a big share of this problem. So we're going by the Margaret Mead philosophy too. We believe we're that small group of people that can really make a change.